Welcome back after the break, everyone. My name is Midnight. I am the Executive Director of AppCom. We are a regional community network based in Bangkok, working on issues around HIV and those that advance the rights, health, and well-being of people of diverse sexual orientation, gender identity, gender expression, and sex characteristics. Welcome to Session 1, Impact of Stigma on You equals You, Part 1, Real World Voices. I am very honored to be chairing this session. We will hear from 4 speakers from the region, and then I will have the pleasure of facilitating some discussions afterwards. Without further ado, our first speaker is Martin Chu. He is from Asia Pacific Council of AIDS Service Organization based in Malaysia. Martin is the Managing Director and Trustee of the Asia Pacific Council of AIDS Service Organizations. Martin is a member of the WHO Steering Group on HIV Drug Resistance Research Network. Martin believes in and fights for equitable and sustainable access to HIV treatment. He has been living with HIV since 2004. Martin's presentation is titled, What You Equal You Means for a Person.
I'm Martin Chu. I'm a person living with HIV in Malaysia. I run a charity supporting services to end AIDS, basically, in Southeast Asia. Our focus is in Southeast Asia and Asia Pacific. U equals U is a difficult subject. I think for us in science, some of us tell it as if it's easy because we obviously understand it. But for many of us, especially if we're not trained in science, it's quite a big leap, right? You're trying to figure out how is it, how are they so sure? How come there will not be any transmission? How would they know? We know 2 ways. First way is we know how the virus transmits. We know the mechanism, the way the virus enters the body, and what cells it latches onto, and how it injects its viral material into the body. We know that. We also know how much of the virus, how active the virus needs to be, how high the viral load needs to be for the virus to transmit. There is a confidence interval, so to speak. And it depends sometimes on the person. But we also know how much active ingredients are in the medication that you're going to take, or even if you're not positive, that somebody is going to take. And we know how effective, how quickly your body clears it. So we know how effective that medication is and how long it stays effective. When we calculate everything, we can tell you quite honestly and straight up that if you adhere to your medication, you will definitely suppress HIV. If you look at people, or if somebody tells you that they can't, that means that the medication that they take is not efficacious for them. It's not the best fit. Put a shorter word. It's not the best fit for them. Well, get a better fit then. Talk to your doctor. Your doctor should be able to give you a better fit. That's what public health has done. There are grades of medication. Of course, there is a cost involved. But if you can show that whatever you're taking now is not good for you. It could be weird dreams, non-stop. It could be lots of things. Whatever you're feeling, whatever is not working, talk to someone. There are people who can help you. You don't have to do this alone. But what we need to do in public health is to make sure that we give everybody a fair chance to that information. Right? It cannot be in a way that they cannot understand. It cannot be put in a way that it will take too much of science to even just get past the first paragraph. Or if people who don't read very well, there is nothing for them. So there's no videos, as far as I know, in many languages on U equals U. Somebody should make them. Somebody should vet the science behind it and present it. We need to reach. U equals U only works when many people do it. Because the medication is so effective these days that it will suppress the virus, sure. But we don't have a normal epidemic in Southeast Asia. I'm talking only from my point of view. We don't have a normal epidemic. We have a close one eye epidemic, you know? All the figures that you see, you can close one eye to see them. Why do I say that? Because certain things are not counted very well. We know what those are. So I can safely tell you that whatever the figures are, it's much higher. I can safely tell you that straight away. And it's much higher, more for certain people than for others. The risk is higher for certain people than for others. In Southeast Asia, it's the youth. If you're under 25 years old, in Southeast Asia, in certain countries, in 6 countries, your risk is pretty high. There are 2 choices, actually, that we know that are going to be very, very good. If you're not infected, try PrEP, pre-exposure prophylaxis. Ask your doctor for PrEP. It's 1 pill, once a day. If your doctor gives you a lot of a lecture on only taking a certain time of day, yes, it's important, but don't lose sleep over that. You just need to take it every day, or as doctors advise. Okay. The other is HIV Anti-Retroviral Therapy. Also amazing. That's the thing that's going to end AIDS. So we've got 2 options. Then there's condoms. Then there's no sex. Then there's what we call combination prevention. So you have many options to choose. Nobody needs to get AIDS. Nobody needs to become infected with HIV in the 21st century, not in Southeast Asia, because most of this is available for free. Our problem is not that the medication is not in the hospital. Our problem now is not enough people are going to the hospital. Or once they start, then suddenly they disappear. So our problems are complex, and they're not usual ones for medication that's already free. Okay, but that's the case, and we must learn to understand which of the people who are most at risk and reach out to them. So it's the 21st century. We can end AIDS. I think we can end AIDS today, but maybe I'm a bit late with time. I'm a bit poor with time. So maybe tomorrow, because the science is clear. The medication is available. It is free for most people anyway. So you just need to get tested and access it. Or if you're already positive, now's the time to access it. Once you suppress your virus, you are a public benefit. Remember that. You are the safest person to have sex in the world. That should improve your market. So go out there, enjoy yourself if you're young, but make sure you do it with as little harm to yourself as possible. And one of those is not to become infected. If you are, don't lose sleep over it. I've been infected now. I've been living with HIV for 15 years. And it's okay. It's not perfect, but it's okay because of medication. So, untransmittable is undetectable is untransmittable. And that's the key. We just need to explain this in a way that people understand. And I hope I've done it today. Thank you.
Thank you, Martin, for a great presentation. Introducing our next speaker, Pete Titiwat Sirasetakon. He is from Thailand. He is known as Pete Living with HIV. Pete is an independent advocate. As a person living with HIV, Pete disclosed to the public and has then been sharing the life story for learning to live with HIV with happiness. Pete's presentation is on online bullying when the PLHAB advocates for U equals U.
Hello everyone, thank you for having me right now. My name is Pete Titiwat. People know me about Pete living with HIV. I'm on medication. I'm living with HIV for 5 years. I'm on medication undetectable viral load since 2016. I am sure myself that I cannot transmit HIV to others because I definitely sure and trusted and believe in you is for you really, really much. I would like to let you know about it before I know about you equal you. I made a mistake a lot because of I didn't know you equal you. I abandoned my business because of I didn't know you equal you. I abandoned my ex-boyfriend because of self-stigma. I abandoned myself and turned myself into dark side, into the people being a drug user. This is why I talk this thing, because you equal you is really important and really mean to people like me, to people living with HIV. I think you equal you is the first thing people living with HIV need to know before taking the ART for the first day. Because I talk to many people living with HIV. I rely on things that if people living with HIV know about you equal you before taking medicine, take a AR medication, their outcome is better in both physical and mental health. It's better than people who living with HIV haven't known about you equal you yet. So this is very important. When I realize and I understand you equal use, my life is changed forever. It seems like my darkest way in my life is certain the light. In that time, I have a lot of self-stigma, and I blame myself and shame on myself a lot, and that made me turn my life into the being for people who use drugs. So when I decided to disclose myself to the public about I'm living with HIV, about since 2018. In that time, I posted on my Facebook fan page, and in that time, I just accept myself. I would like to be myself. I don't want to be hidden myself to anymore. I would like to disclose to my friend in Facebook. That make me realize one thing, that a lot of people come to me with a good comment and cheer up to me to do something great, and I open up myself to create the community, to talk with the people living with HIV in Thailand in that time since then. So in this early of year, we have a story about me directly experience to be bullied from society, who don't understand about what is you equal you mean. Even they haven't known about people living HIV like me cannot transmit the HIV to others. So in this early of years, many people come to talk with me with the negative comment, okay, and that make me very popular in that time, and that make me have I have my own hashtag to trend Twitter for over 3 times in that time. So they disagree with me because I express my sexual my sexual identity, my sexual preference to the public. That when I am positive, undetectable, I cannot transmit the HIV to others. So I can enjoy with my sexual life. That made me a lot of conversation. A lot of people would disagree with me because they thought that I will be transmittable to others. So I try to let them know that I am living with HIV, but I'm on medication. I'm suppressed viral load, undetectable, untransmittable, or use equal you in Thailand in that time. But I try to talk this. I try to speak it. I try to understand it. I try to let them know that this is fact. This is a truth. This is true. This is correct. But they don't believe me, and they come to bully me. One word they always say to me is, "If you are brilliant, why do you have an HIV?" So then I asked them back that, don't I have right to learn in HIV because I'm living with HIV? I answer myself that yes, I have right to learn. I don't even have right, but I have to learn to living with HIV, and I have to learn to accept myself, how to living with HIV, because no one used to be HIV positive before, right? So when I become an HIV positive person, I need to learn how to living with HIV. So that's made me learn a lot since then until now. So all of my life, I walked through school and medication, hospital, organization, health organization. I thought that I understand for HIV in that time back then, but I realize now that I didn't even know about the HIV in that time. That made me lack of understanding, lack of knowledge to living with HIV. I decided until I living with HIV, until I understand it, until I learn it, until I realize it, until I share my story with well understanding. So this is one of the negative comment to me, and 80% to 90% to people come to comment on that situation, and bullying comment and negative comments. So what are the actions that we found? That we found something that they didn't know, they haven't known about you equally yet, and they even know that people living with HIV cannot transmit the HIV to others. So we need to speak more often and louder about you equal you. And I would like to share how to speak, to talk, to advocate you equal you, that we advocate you equal you seem like everyone in the world accept you equal you already, with no doubt, with no any doubt anymore. So when I advocate you equal you, that I say, I communicate, seem like everyone in the world accept you equal you. I will not talk about you equal you is real or not, correct or not. I will accept it. Yes, you equal you is the truth. If you don't know, this is your mistake, not my mistake. If you are, even especially if you are living with HIV, you have to know about you equal you. If you being bullied, you need to protect yourself, and I would like to tell everyone that whatever the goal in the society we are, we could stop, eliminate, and suppress and mitigate the bullying to the people who are being bullied, and don't be a part to support the bullying to any people. So no one deserves to be bullied. Everyone deserves to be respected as a human being. So just human being, I think, is too much enough to be respected to each other. So I hope everyone in society will help to stop bullying. Start by yourself, and by community, by a family, by friends, and stop and don't support bullying to society. Thank you so much.
Thank you very much, Pete, for your presentation. I am now pleased to introduce Eddie Redram. Eddie is from Thailand/UK and is the Communications Officer at Youth Lead in Bangkok. Currently, Eddie is managing the YKP COVID-19 Emergency Relief Fund, a grant scheme aimed at supporting youth-led initiatives at the time of COVID-19 for YKPs and YPLHAV across Asia and the Pacific. Eddie's presentation is titled Youth Perspectives on U equals U Communications.
My name is Eddie. I'm with Youth Lead. Thank you so much for having me here to talk on youth perspectives on U equals U communication. I guess I'll just get right to it. So this is going to be the outline for my presentation. There could have been many directions I could have taken this with, but I consulted with young people before making this presentation to make sure it was incorporated youth perspectives. And after the discussions, we found that there was two key thematic areas that was worth highlighting. So I'll be talking about U equals U campaigns and language as the first part. And the second part will be about why U equals U communication is important for young people. So just to provide a little bit of context behind HIV language. As we all know, language is an extension of communications. Language is a tool that we use in communications, and communications is how we transfer messages, and it's the process of transferring messages. We know that there has been a shift in the language used in the HIV/AIDS space. What was appropriate terminology in the past may not be appropriate terminology today. And we recognize that it's because of language that we are able to understand other people and understand ourselves. I think at some point in our lives, we would have had words or language negatively impact us. I mean, for example, if we use terminology like transsexual or AIDS orphan, prostitutes, these are all negative language that we shouldn't be using, and we know that. But often at times it does come up and it does impact us negatively. So if you understand that from the perspective of a young person who is living with HIV or is surrounded by negative HIV language and the discourse and the narrative, they could grow up feeling a little bit out of place, feeling not accepted. So this could be a huge issue for young people if the HIV narrative and the language does not change. Okay. Undetectable equals untransmittable. Now that is not an easy concept to say. It's 12 syllables. Just imagine a young person who is not a native English speaker trying to say this concept it's going to be quite hard. But we have seen now around the world that people have adopted U equals U into the local context so that it becomes more relatable to that given locality. So I think this now brings me to the examples of campaigns, which is the first part of my presentation. Here we see examples of campaigns. We see campaigns that are actually taken from the West. These photos were actually taken from preventionaccess.org, which is a website that collects information on U equals U and also campaigns. It's a very good website, check it out. But these campaigns are taken from the West. We can see that they're very engaging. You use people, actual real people in the campaigns. The letters are bold and there's lots of color. It's very inviting. So these campaigns actually do very well in kind of communicating what U equals U is. And some of them even go on to explain more in detail what is U equals U without just actually having the letters U equals U right there. But I think it's also important to notice that not all campaigns are in English, obviously, because the whole world doesn't just only speak English. So it was nice, sorry. Now I'm going to provide you examples of non-English campaigns. What's interesting to note here is that in countries like Brazil or in Vietnam or in Germany, they've adopted different concepts. So, for example, in Brazil, it's I equals I, not U equals U. And in Vietnam, it's K equals K. So I actually spoke to a young person who was actually involved in the K equals K campaign. And he said that the campaign did very, very well in addressing stigma and discrimination. It also promoted and encouraged people to get tested, which was great. And it also kind of promoted adherence as well for young people who are living with HIV. I think this really kind of shows that it's important for campaigns such as U equals U to be adapted into local context, just so that the campaigns can be relatable to the audience. Because like I said, U equals U, it's not an easy concept to understand if English is not your first language. So it's important to bear that in mind when we're looking to move U equals U from English campaigns to the local context. One thing that it's worth pointing out is the language that is actually used in the campaigns. Unfortunately, I can't go back, but I can explain that if anybody noticed, that in the English campaigns, you might have seen these types of terms used. The science is clear. Facts are facts. You cannot pass HIV. It's zero risk, effectively zero risk. We see this type of terminology used because it's a standard campaign strategy to make sure that the U equals U campaign aligns with the general HIV language. So it's to make sure that everyone's on the same page when it comes to talking about U equals U and HIV, and to make sure that the messages are clear, it's concise, and it doesn't deter away from the general HIV language that sometimes we often see, which is to the right, such as infected or infection, HIV infected, unprotected sex. These are sometimes the language that we often see in campaigns, which are not true. And as we know now, as people who work in the HIV space, that this does promote stigma and discrimination. So it is important to change language. It's important to change how we communicate information on HIV. As we already know, the language can stigmatize HIV and the people living with HIV. It can isolate people living with HIV from the greater public. But for a young person who's growing up and surrounded by these myths and false stereotypes of HIV, which are also reinforced by the media and social environment, it can have adverse effects on the way that they understand HIV, and it can deter away young people essentially from even just getting tested. So I think that U=U campaigns do work very well to address stigma and that surrounds people living with HIV. It uses terminology to deflect misconceptions and false stereotypes about HIV. And it also promotes positive language that we should be using when we discuss people living with HIV or people are affected by HIV. So why is communication on U=U important for young people? It promotes testing, it promotes HIV treatment, and it talks about HIV in a way that young people can understand. There are three things that I want to highlight as important areas. There are many more, but I think there's just three that I want to highlight for now. U=U has an enormous benefit in reducing stigma and discrimination, and it can motivate young people to get tested, to stay on treatment. For this, it's important for us to raise awareness and promote the knowledge of U=U within the healthcare sectors and communities and the people living with HIV, because a lot of young people still are not aware of the U=U concept. And as a result, I think that it should also work to address the internalized stigma that young people have. Someone living with HIV, they often engage in social avoidance, so they don't want to, get married or have children or have sex. It's because they feel like they're different from everyone else. So I think U=U campaigns can really do well in addressing stigma and discrimination. And with the other two issues I want to bring up is adherence and empowerment. I think with adherence, I think we all know that there is poor ARV adherence among youth. And U=U campaigns can have a great role in achieving and maintaining viral suppression. ARV adherence is often impacted by poor social support, such as low ARV self-efficacy, advanced HIV disease, psychological distress, depression, substance use. These are all factors that can really play on a young person's adherence. And I think U=U, if it's promoted by healthcare sector workers, and the community, I think could go a long way in improving adherence. And the last one is empowerment. I think U=U is empowering because it can unite young people together and get them to act as agents of change. It can really take away the shroud of fear that exists for young people, feeling like they're different. So U=U has the ability to kind of mobilize young people to become agents of change within the HIV movement. So a lot of communication should focus on empowering young people as well. I've listed some recommendations or some ways that we can improve communication on U=U. One of them is communication that empowers young people living with HIV to become agents of change, and I've already said that. Communication that promotes testing for young people and young key populations. Communication that encourages adherence for adolescents and young people living with HIV. Communication that addresses stigma and discrimination, false stereotypes, myths on HIV, and communication on U=U that is youth-friendly and easy to understand. Because like I said, it can be a very difficult concept to understand. So we need to find easy ways to kind of communicate information on HIV and U=U in a way that young people will take that on board and actually talk to other young people too about U=U. But more importantly, it's about creating content that relates to younger audiences. If we examine the different languages that we used in the campaigns, we should be using them as well in this region, not just in the West. But also there are challenges to that. You know, we are in the Asia Pacific region. We're not going to be able to see campaigns with two men sleeping side by side anytime soon. That's just not going to happen yet. Well, I hope it changes one day. But it does go a long way because, for example, if I saw a campaign on LGBTQ acceptance, that's going to do a lot to bring up my self-confidence. It shows me that the people are supportive, I feel included, I don't feel left out. It really goes a long way. So the way that you equals you campaigns work for young people would do the same thing. It would make them feel included, it will bring up their self-confidence and self-esteem, and it will make it seem like there's a form of normalcy in their lives and it doesn't take them away from feeling different. So just in summary, I mostly talked about language and talked about the campaigns with You Equals You. And hopefully everyone here gets an understanding of the ways that we can improve how we work with young people, whether it's within service delivery or even just facilitating a workshop. There are different ways that we have to, other things that we have to consider when we're working with young people, or if we're trying to communicate messages with young people. Not that because they're not going to understand it or their lack of knowledge or something, but it's the way that it has to relate to them. Otherwise, the campaign just fails because he doesn't know the audience. Young people often slip through the cracks. So it's important for us to bring more attention to how we work with them and what it is that we're trying to communicate with young people. For a young person, this can be empowering and it can allow young people to take charge of their lives without fear.
Thank you, Eddie, for the presentation. Last but not least, our next speaker is Rain Cortez. She is from the Asia Pacific Transgender Network based in Thailand. Rain is a trans woman advocate from the Philippines and has a master's degree in health social science. She has more than 10 years of professional experience in mentoring and evaluation, program, financial, and grant management of HIV and AIDS prevention and control, community system strengthening, and trans-Pacific health and rights-focused interventions and research. Rain's presentation is called You Equals You and Stigma in Transgender Community.
Hello, everyone, and welcome to this session. For this specific session, I'll be talking about You Equals You and the stigma in the transgender community in Asia and the Pacific region. The Asia Pacific Transgender Network, the organization I'm working with, is a trans-led organization and a regional network that engages with different partners across Asia and the Pacific region. And we advocate for fundamental human rights, including gender identity, as well as access to justice and legal protections, and of course, comprehensive gender-affirming healthcare and policies for trans and gender-diverse people in this region. And we generally work with country trans-led and trans-inclusive community-based organizations in 4 sub-regions, including Southeast Asia, South Asia, the Pacific, and East Asia. And since our network revolves around consultative processes and ensuring that voices of the communities on the ground are heard, we consulted and gathered inputs on this You Equals You session and the corresponding stigma among trans community with around 17 country partners in Thailand, Philippines, Indonesia, Vietnam, Timor-Leste, Myanmar, Laos, PDR, India, Nepal, Pakistan, Bangladesh, Mongolia, Papua New Guinea, Samoa, and Tonga. So a lot of the things that you will be hearing for this session are coming from the perspectives of our communities on the ground. The work that the Asia Pacific Transgender Network revolves around ensuring that we provide guidance and reference materials for rights-based comprehensive healthcare for trans people in the different parts of the region that we are working with. And as a context builder to this session, currently the estimated population of trans people in Asia and the Pacific is 9 to 9.5 million, which remains to be a very low estimate. And based on HIV vulnerability of trans people, they are 12 times fold higher risk than general population. And given this HIV vulnerability, specifically about transgender women, that there is related HIV stigma and transphobia that creates the barriers to accessing of HIV testing, even prevention interventions and treatment services by transgender people. And again, this is only mostly focusing on transgender women, which is seen to be a key vulnerable population, and not including transgender men or transmasculine population. One of the things that we consulted with our partners in this consultation and presentation is what is their current understanding and awareness of U equals U. And surprisingly, that most trans people actually have very limited or low awareness and knowledge on U equals U. And this remains to be somehow a very new concept to them, even though it has been years that U equals U has been proven by science to be very effective. And for those that are aware of U equals U, these are mostly pertaining to transgender women, which are considered to be a key population for HIV programs, and that U equals U is not discussed and focused on among transgender men and transmasculine people, where there is very limited data in terms of her vulnerability as well. Those that are most aware as well are trans people who are working in HIV-related programs and services coming from community organizations, and those trans clients that are actually accessing HIV services. For those that who are aware of U equals U, they actually see and understand that U equals U is a goal to attain and maintain. And actually in some countries, U equals U is not fully expounded and only explained in the limitations of the context of viral load and why it needs to be maintained and controlled to be low. In terms of existing campaigns in countries that are targeting trans people or transgender people living with HIV, many of the communities on the ground are not aware of any campaigns on U equals U, or there is actually no existing campaigns on U equals U currently in those countries. And for campaigns that are existing, these are done using social media, and they are designed generally for people living with HIV, and mostly are done by specific organizations rather than a national level intervention for U equals U. And of course, there is no trans-specific campaign that is ongoing on U equals U in any of the countries that we work with. U equals U in those countries becomes part of their prevention awareness campaigns, and in some countries, they're also supporting trans-led community organizations to actually have and develop their own trans-specific campaigns on U equals U. And these were just actually some of the U equals U campaigns that are happening in Vietnam, Indonesia, and in the Philippines. It revolves around information and awareness and messaging through social media, Facebook, website, infographics. They do online interactive shows, as well as messaging and using, for example, hot doctors or nurses, as you can see on the right side. But as you can see, all of this messaging are catering to general people living with HIV, and none are specific to trans people, which is still remains to be a lacking component. In terms of the context coming from the healthcare providers and knowledge of trans people, if this U equals U messaging and principle is being used, most healthcare providers and community-based organizations that are peer providers are including U equals U in their prevention messaging and even on their one-on-one counseling and IEC materials. But this is not very consistent. Not all healthcare providers include U equals U messaging in their counseling, and there are varying practices in the public and private settings of healthcare professionals. There are also some openly PLHIV advocates that are openly talking about U equals U, which is a good intervention, but none of these ambassadors or advocates are actually transgender people in the region. So is there really a stigma in terms of U equals U within the transgender community? Due to the lack of awareness and knowledge on U equals U itself, stigma and U equals U is not very clear among transgender people. However, what we need to look at is the other intersectional persisting stigma that affects transgender people in terms of accessing healthcare services, including HIV services, regardless if there are vulnerable populations or people living with HIV. For example, the persisting stigma among trans people in accessing healthcare and HIV services for the fear of being discriminated due to their SOGI status or sexual orientation, gender identity and expression, or even because of their occupation, maybe as a sex worker, and even their different sexual practices. There remains to be a lack of sensitivity among healthcare providers and health facilities, not recognizing their gender identity, especially for countries that don't have policies for legal gender recognition or change of gender markers, for some experiences of misgendering, and of course, the typical stereotyping of LGBT community, especially trans people, as carriers of HIV. There is also stigma of knowing one's status among trans community because it could lead them to losing their jobs or even not being accepted by their family, especially in jobs, for example, in bars that may require them to actually do blood tests. An important stigma that needs to be addressed in relation to this is the fact that in healthcare settings and in some countries, they remain to be pathologized, being diagnosed with gender identity disorder or gender dysphoria for them to be able to access free healthcare services and be seen as having a mental illness that needs to be treated. There's also an interesting stigma that needs to be looked at in the context of contraindication of antiretroviral therapy and hormone replacement therapy or gender-affirming hormone therapy, wherein in cases that a person or a trans person is given a choice whether to either take ART or HRT, because there were some cases and stories or accounts that doctors are letting them choose and prefers them to take ART and stop their HRT. And it's a matter of a choice for the trans person to actually take into account which is prioritized or equally important for them. And for trans people, there remains to be a stigma of being economically vulnerable. And as we know that viral load testing is not usually free in most countries, and the ability to consistently pay and to monitor for viral load testing will remain to become an issue because trans people who are economically vulnerable need to prioritize which costs they need to focus on and earn for, and to be able to maintain their constant living. This, of course, leads to low testing uptake, treatment initiation, and treatment adherence as well. In terms of key messaging and key recommendations coming from the trans community, especially in the context that U equals U is fairly a new concept for most trans people, and greater awareness and knowledge needs to be embedded within the trans community. So these are just some recommendations coming from the community to have a trans-led and trans-specific U equals U campaign and messaging, especially through social media, which is very useful, and having a trans PLHIV support group that understands the issues of transgender people in general, as well as having trans people living with HIV as ambassadors in promoting U equals U among the trans community. The other statements in here are specific recommendations or key messages that the communities are sharing. And let me just read to you a few of them. For example, awareness of U equals U principle is also U equals U offering freedom and hope, and be aware of U equals U and stop stigma and discrimination among trans PLHIV. No stigma equals no new HIV infection. Adherence, positive living, and well-being. Keep testing, keep informed, keep smiling. And as part of taking care of oneself in relation to one's self-worth, it is imperative to focus on adherence to treatment for HIV, like our adherence with hormone therapy. So if you would like to learn more about the work of APT and especially our country partners, our trans-led organizations and trans-inclusive partners on the ground, please do send an email to me, or you can also visit our website, our Facebook, and our Instagram account. Once again, thank you for listening and have a good day.